40, 50 people in the waiting room, so we may not hit 100.
Okay.
I'll give about 5 minutes and then turn it over to you.
Okay, great.
Welcome, welcome, welcome in, everyone. Welcome to Care Concierge with Carepatrol, where education is the heart of everything we do. We appreciate you being here, and we appreciate your referrals to us of clients and patients who may need assisted living or sitter services or memory care, or may just have questions that need answered. We're happy to do all of that, and we're at no charge, and we appreciate your trust and faith in us. We, as you know, twice monthly do contact hours at continuing education units. We're credentialed by the Alabama Board of Nursing. We're also credentialed by the Alabama Board of Social Work. And each of those entities say that this class is a 1.0 contact hour. We try to have our classes be those that previous attendees have asked us to do. So Medicaid waiver, today's topic, is an often requested topic. And I feel like today we finally achieved expert status in talking about it with our presenter, as I have tried it in the past, and it is much more in her bailiwick than mine. We do encourage discussion, and we hope you'll ask questions and participate. If you're new to Zoom and you're not sure how to enter the chat room, move your cursor up to the top of your screen or move it down to the bottom. At one point, a bar shall pop up with the word chat on it. Click in there and add your voice to ours, or ask me to unmute you. And we'd love to hear your thoughts and outcomes and opinions as well. We all treasure and profit from what you do and what you know and your outcomes. So we welcome you in. We hope you'll join the discussion. In order to receive a certificate today, you must complete our password protected online evaluation. We'll give the password out at the end of the hour, but I'm going to go ahead and read to you the link. It is in the chat room as well. The link is https://www.surveymonkey.com/lowercase r/ all uppercase letters, D as in David, H, 9, N as in Nancy, 6, R, V as in victory. That is our online password protected evaluation. We'll give the password out at the end. Thank you for being here, and we'll welcome now our presenter, who is Shammara Johnson. She holds a master's in social work from the University of Alabama, and she works with the Regional Planning Commission of Greater Birmingham, which in Jefferson County is the entity that oversees Medicaid waiver. So she is the woman you need to know if you have questions about Medicaid waiver, and we'll welcome her in now. Thank you so much, Ms. Johnson, for being here.
Thank you. And thank you for inviting me and having me. It's a pleasure to speak with the community and others regarding our program. We want as many folks as we can reach to understand and know that our program exists, and we're always welcoming, new applicants and referrals. I wanted to start off by saying I thank everyone for being here. Again, I'm Shammara Johnson. I have been working with Medicaid waiver for approximately probably about 15 years now. I started off as a case manager in 2009 after graduate school, and I used to do home visits. And eventually I got my hands into initial assessments, and then I was promoted to be the assistant supervisor for the assessment coordinators. I currently supervise 4 individuals on my team. They go into the homes, they do the in-home assessments, they do the paperwork, and I supervise them. I too still go out into the homes, just not as much as my team. So we are constantly working. We're constantly trying to get more folks on our program. My office, we serve Jefferson County only, and we have about 950 members active on our program at this time. Our program is the Elderly and Disabled Waiver Program, and we do not have an age limit on this program, but I'll get into that much later. So the purpose of the program, it allows individuals who are elderly and disabled to apply for long-term care services that is provided inside the home, and the program prevents nursing home placement. Now, I just want to piggyback off of that and say that, you know, sometimes we find individuals that may require 24-hour care. Unfortunately, we cannot service those individuals. They are better suited for the nursing home if they require 24-hour supervision and care. The basis of the program are found on two reasons. And I have to move this up, I'm sorry. The program has demonstrated to be cost-effective than nursing home placement, which reduces the cost to the state of Alabama. So yes, it costs the state of Alabama less money to keep individuals in the home rather than have them go to the nursing home, okay? How much money the state saves? Unfortunately, I do not have that answer, but I'm going to assume it's quite a bit of dollars, high dollars. Most individuals will rather live in their home rather than reside in a nursing home, and that is perfectly fine. Our main objective is to make sure that we have members that get on our program for services. They're in a safe and sound environment, as long as they don't need 24-hour care. And the services is to keep them in that home environment where they're most comfortable. Okay. So there are some financial requirements for the Medicaid waiver program. The person has to receive SSI, or they have to be eligible for full Medicaid. So let's just say Jane Doe does not have SSI, but she's interested in applying to our program. Well, Jane Doe's income has to be less than $2,829 per month. Has to be 300% of the poverty level. Unfortunately, Alabama Medicaid does not budge on that. So what I mean by that is, if someone is receiving $1 more, unfortunately, they're not financially eligible for the program. But that is the income limit for this year. The income limit for the long-term care program, it changes every January. So when we get to January 2025, you know, I will get with the Medicaid supervisor and find out what the income limit is, and we'll change, you know, that information. Now, there is a resource limit. The resource limit cannot exceed $2,000 on the first day of each month. And resources would be what's in a person's checking, savings accounts, loans, cash, mutual funds, stocks, bonds, etc. If an individual has more than $2,000 in resources, they are financially ineligible to apply to our program. So the resources that they do not include in that is primary estate, vehicle, household goods, pre-need contract with the funeral home, and life insurance, or any insurance with the cash value, if the total combined face value is less than $5,000. Now, if the insurance is over $5,000, Medicaid does not automatically deny the individual. They may ask for additional information, may have them sign a document that states that if they should cash out their policy, you know, they have to notify Medicaid. And the reason for this, if a person has more than $2,829 per month and more than $2,000 in resources, well, the state looks at it on the perspective of that person can pay for their long-term care out of pocket. Okay, but those are the income limits. For SSIs, for individuals that receive SSI, they automatically qualify financially because they have SSI, which means they have full Medicaid. So anyone that receives SSI, a SSI check every month, they automatically qualify for full Medicaid, and they should already be receiving those benefits. Okay. The services that we offer our members are based upon what they need. So this goes back to me and my team, the initial assessors. When we come out to the home, we are looking at several different things to figure out what that person needs. We're looking at the home environment. We're checking on how many people are coming in here, who live here, who's helping. Even if someone is coming by to check on the person, I mean, we need to know that. Like, are they helping the person at all? So we kind of need to know what's going on in the home environment, because it allows us to put together a decent care plan in which, if they get approved, they get the services that could fit them best. So the services that we offer our members is homemaker, personal care, unskilled respite, skilled respite, skilled nursing, companion. I apologize. My supervisor confirmed that we do not have the personal assistant services, so that's why that says not applicable. We have home delivered meals that come from Trio. We used to have adult day health center. Unfortunately, the last time that we had a center was in 2011. We have not had one since. The reason it varies. If a business is going to provide adult day health for our agency, they have to be willing to accept Medicaid's rates. They have to be able to provide transportation to our members. And they also have to be able to provide at least a meal or snack at the adult day health center. Right now, we don't have one though in Jefferson County, which is unfortunate, but we just don't. My supervisor has tried and tried to see if we could get certain companies to contract with us, but unfortunately, we have not been successful. Okay, we have the home modifications. The limit is 5K. We have the personal emergency response system, which is a PERS. We have medical supplies at $100 a month. And then we have the DME assistive technology assistance, which is about 2K a year and then 10K for a lifetime. We recently received the green light to provide expanded services. So expanded services are the home modifications, the PERS, the medical supplies, and the DME/assistive technology. For individuals to receive those, they have to exhaust other resources first. So if a person has Medicare and they have an Advantage plan, that Advantage plan may cover certain supplies that they need. If it does not, of course, they can, get those items that they need from our agency. The first service that I skipped over because I want to go in depth about that is case management. So,
Excuse me, Ms. Johnson, before we
yes.
get down, because that's going to
Mhm.
be an important topic. We have a question, which
Yes.
is, does the home modification include a wheelchair ramp?
Yes, home modification would include a wheelchair ramp or stair lift, and it has to be a need for it. If there is no need, it will not be approved. And
Got
it's
it.
not based upon if the person just wants it. It has to be a need for it. Okay.
Who assesses that need? Your team?
The case manager, that's what I'm about to get to the case management
Oh,
part.
great.
Yes, yes. Okay, so with our members, we have 950 folks on our program. Every one of them has a case manager. Case managers, they visit with our members once a month, which is required by the state. The case manager comes out to do a monthly face-to-face visit to check on members, see how they're doing, if they're satisfied with their services and the care that they receive, if they need to be linked with any resources in the community. And yes, Sean, they can definitely help start the process for home modifications. Me and my team, we do not do the home modification because there's so much paperwork that goes into that is best suited for the case manager to do it once the person gets approved.
And we,
And
we have a follow-up question to that
yes.
one
Mhm.
from Ms. Potts, who asked, does the house have to still be in the patient's name in order for them to get modifications?
I don't think that is an issue. What we have come across is that some individuals live in a home that they're renting. And so they may need a ramp, but their landlord or whoever they rent from, they have to approve that. And sometimes they don't. So what I've seen thus far is that some of our members that own their own homes, they're able to get the home modification as long as it's approved by the state. That doesn't mean that their house have to be in their name. But if they live with somebody else, that person that owns that house has to be willing to accept the home modification. And
Right.
we have come across that. I think there was a member, they lived with another person, but they needed a home modification. I cannot remember exactly what it is that they needed, but the person that owned the home, they did not want that modification on their house. So we couldn't do anything. Okay. So it just depends on the person's situation. For example, if a person is renting an apartment, as you all may know or may not know, well, you can't really provide home modifications to that because the client or members don't own that apartment. So if you own your house, you're more likely to be able to get that home modification, but there has to be a need for it. Okay. Now with the case managers are given about 30 to 45 clients. They visit with them once a month. They link them with resources. They also have to make sure that the client is receiving services and the care that's required on the care plan. Sometimes if something is wrong, case manager is the go-to person, et cetera, et cetera. And we have some really good case managers. Okay. In reference to there was one service on here that I don't think that I listed. It's called Personal Choices Services. And I apologize about that by not being on a PowerPoint slide. Personal Choices allows our members to hire the person who they want to provide the care to them. And that person can be paid for it by Alabama Medicaid as long as he or she passed a criminal background check. If they do not pass the criminal background check, they cannot be compensated to provide the care to the member. Okay. So that could be family, friends, church members, or associates. The person has to be, I believe, 19 and up in order to be compensated to provide the care to a member.
But they don't have to be a trained caregiver, just a
No, they
willing
have to be a
body.
willing person that's willing to do it.
And we have a
It's
new question from Miss
mhm,
Speak. She
mhm.
asked, what is the solution for a shortage of direct service providers? I have assisted many elderly residents with Medicaid waiver applications and approval in Limestone County, only to be informed that there is no direct service providers available to them due to a shortage. Some residents have family or friends that sign up for personal choices option, but not all applicants have that option.
Right. Well, to be honest, we don't have a solution at the moment because there is a shortage. There is a shortage in nurses. There is a shortage even in the direct service provider workers. For example, I don't know about the county she lives in, but I know in Jefferson County, we too have a shortage. And the only thing that we can't do anything on our end, but we're constantly checking with the direct service providers that, hey, do you have new employees that can service, our members, or can they service this person that lives maybe in Leeds or et cetera? So unfortunately, there's not a solution to that. The direct service providers, they are responsible for hiring staff. That is not something that the Medicaid waiver staff does, but the direct service provider, they have to hire staff. And unfortunately, it's just a major shortage. It's even a shortage for skilled respite services. It takes a skilled person to handle someone that has a G tube or GJ tube or trach, or on a ventilator. It's just a shortage around the board. And I mean, I hope, of course, that gets better over time, but it's really hard to say. Now, if that person, because personal choices is not for everyone, like that person was asking in the question. So if they can't get personal choices, unfortunately, the case manager will try every step of the way to get them staffed with a direct service provider. If the case manager cannot get them staffed because there's a shortage, the person's services will have to be placed on hold. But the member can decide, they have autonomy. So they can decide if they want to self-terminate or just wait it out and put the services on hold until a direct service provider has a worker. I know for us in Jefferson County, our direct service providers, they usually reach out to my supervisor, Ms. Bridget Phillips, and they'll let her know, hey, we have some workers if you guys need some folks to be staffed. So that's really helpful when they let us know that they have new staff members that can help service our members. But it's a shortage across the board, and it's just unfortunate. And I hate that, of course. So, but I'm hoping maybe that'll get better in due time because, yeah, you're right. Everyone can't receive personal choices.
Is there currently a wait list for waiver services?
In Jefferson County, for my office, yes, we don't call it a wait list, it's a referral list.
Okay.
We receive, well, I'll say this, in 1 month, we received almost 150 referrals in 1 month.
Wow.
1 month. I have 4 people that are assessing folks. I assess 2, but my assessments are on a part-time basis. So we do have a process. We do get the referrals. We have a screener. That screener, she contacts every referral to make sure that they're still interested in being assessed for the program. And the reason why we have a screener is because we do receive referrals that are not appropriate for our program. We receive referrals from individuals that, let's say, for example, the hospital worker or the nurse or whomever may think they need the service, but the client doesn't want the service. So we have a screener to kind of weed those cases out so we don't have them on the list. And that way we can focus on the ones that really need the help and the services. Were there any other questions before I go to the next part?
No, ma'am.
Okay. Now, the application. So after my team and I complete the in-home assessment, the doctor has to complete a medical form for that member to vouch that they meet nursing home level of care. So that's the first step. The doctor has to complete the medical form. If the member does not have SSI, there is a 204, 205 application that the member has to complete. We do assist them with that if they need help. If they have a caregiver that's able to do it, that's great too. So once we receive the paperwork from the doctor and the application as applicable, we get everything submitted, and it gets submitted to the Alabama Department of Senior Services, where a nurse reviews that person's application. They determine whether or not that person will be approved medically. They determine whether or not that person is going to be approved or denied medically for the program. If a person is denied at that level, they will send them a denial letter, and that member or caregiver, they can go through due process and appeal the denial. The denial does not, even if they appeal, it does not mean they'll automatically be approved. And so if they are approved, then the next step is Alabama Medicaid has to review that applicant's 204, 205 application and do a 5-year look back period to determine if that person is eligible for full Medicaid in order to get the services. When the application gets to the Alabama Medicaid agency, a caseworker is assigned to that applicant's case. They will do an interview with the member and or caregiver or sponsor. They may request additional information. It just depends on the assets that the person have. And then they are the ones that make the final determination of whether or not that person will be approved or denied for services. If they are denied at the Alabama Medicaid level, they can still complete the reapplication process and they can still appeal. If they are approved, of course, that's when my agency takes over, and my supervisor will assign that member with a case manager. And that case manager will start the process to do the plan of care and to start the services. Now, if a person is approved for services this year, every year applicants have to continue to qualify in order to continue to receive the services. So every year, doctor has to complete the medical form. For those applicants that do not receive SSI, Medicaid will send them something by mail. They have to make sure they fill that out every year. Okay. And that is very important. We've had some situations where a person may have forgotten to update that information. And so when they lose their full Medicaid, they cannot receive our services. However, we do not terminate them. We put the services on hold until we can get that situation rectified. Okay. That's not the first step we want to do. We don't ever want to just terminate folks. We want to get it situated so that they can get their Medicaid back and we can resume with the services. Okay. Were there any questions about that?
Yes, ma'am.
Okay.
Ms. Granger is asking, by doctor, do you mean PCP, or can it be a specialty provider such as pulmonary or cardiology?
It can be a PCP, nephrologist, neurologist, cardiologist. It could be other specialties as long as that physician is willing to complete the form. In my experience in this position, the only specialist that I have seen that refuses to complete the medical form is the pain doctor. We we have sent, medical forms to pain physicians in the past, and they return it blank saying that they don't want to fill it out. Maybe the primary care can do it. If we cannot accept medical forms that are completed by psychiatrists nor psychologists. Our program is based on physical disability, not cognitive or intellectual disability. So, for example, if an applicant has a psychiatrist and we send the paperwork to them, but we don't know that they're a psychiatrist, if the medical form gets sent back to us, we cannot use that. It has to be a medical doctor. Were there any other questions about that if I go to the next part?
No, ma'am, but I have a question. So you
Yes.
said that you don't serve people with cognitive challenges. Is that correct?
Right. So, for example, Jane Doe has, I'm just using an example. Jane Doe has diagnoses of bipolar disorder, major depressive disorder, schizophrenia. That's all she has on the medical form. Unfortunately, she's not applicable for our program. She's better suited for the intellectual disability waiver or possibly the SAIL waiver. There are other waiver programs in the state.
Got
Okay.
it.
Our office, we are the elderly and disabled waiver program. So we only serve that part. So we've had that happen. We continue to get those type of cases. And of course, we do refer them to the applicable waiver program that's best to suit them.
Great. Ms. Williams is asking, what is the average time from start to finish from the assessment to when services are actually in the home?
To be honest, I don't know. It varies because there's so many variables in this. The doctor has to do his part. Alabama Medicaid have to do their part. Once the case manager gets it, can they staff the member? So if we're going to just throw a number out there, I mean, it could be a month, or more. It could be a month or a month and a half. It just depends on the person's application status. If they are SSI, those applications get reviewed, and when they get approved, we can go ahead and start. For applicants that don't have SSI, they're having to be approved at two different offices. They have to be approved medically and financially. And so those applicants, those can take a little bit longer because Alabama Medicaid has to verify that they're eligible for full Medicaid. So to be honest, it just varies on a case-by-case basis. There is no set number to really give on that. And I hope that's okay. I mean, I know, sometimes people want some type of number, but it's really hard to say. It's a case-by-case basis.
I
And
think four to
especially if we're
six
talking
weeks
about,
is, I'm sorry, 4 to 6
go ahead.
weeks
No.
is pretty quick turnaround.
Yeah, yeah. But I've seen cases where, to be honest, that, even some of my team members have had cases where the member has been pending Alabama Medicaid for months.
Huh.
Because once again, different variables involved. The caseworker has tried to do the interview. Person hasn't answered the phone. Caseworker sent the letter. Person hasn't responded. So now they give them time, but then now they have to close it out. Or they requested additional information and the person has not given it to the caseworker yet. Of course, we try to help as best we can, but we are not their sponsors and we are not their representatives. And sometimes some of the caseworkers will not talk to us when we try to find out, okay, so Jane Doe needs such and such. Maybe I can call and find out what they need. It just depends on the caseworker. I've had some caseworkers that wouldn't tell me anything. And I've had some that will say, well, hey, can you help this person fill out this form and get it back over to me? So it just varies,
Mm.
Mm-hmm.
Ms. Granger is asking, is there still a waiting list in Jefferson County?
Yes.
Okay. And Ms. Williams is asking, if a person does not have SSI and they
Mm-hmm.
own a home, is
Mm-hmm.
there still the possibility of a lien being placed on the home if they are approved for Medicaid waiver services.
Correct. That is called the State Recovery Act. So let me explain that. Oh, by the way, Ms. Granger, we don't have a wait list. It's the referral list. Now, going forward, what was the, okay, about the,
Her question was, is there still the possibility of a lien being placed on the home if they're approved for waiver?
okay, so that's called the State Recovery Act. I just give brief information. I'm not an expert on it, but I will definitely tell you all what it is. Any person in the state of Alabama that uses SSI or long-term care services from the Medicaid waiver program, if they have a home, land, money in their checking or savings upon their death at the age of 55 and up, they are subject to the State Recovery Act. There is no way around it. It has been in place for many years. It's actually mandated by the federal government. Federal government implemented that all states try to collect some of that money that's being put out for long-term care services. So unfortunately, if a person has a house and they decide to receive our services, when that person passes away, Alabama Medicaid could recover any assets or money that's left over from that estate to pay back what was used to help that member stay in their home for long-term care. And we do tell all of our applicants about this. We even tell the parents of children, and it doesn't even apply to children, but we still want everybody to be aware of this fine print. That's what I call the fine print. So we do provide a contact sheet for them if they wish to contact the state recovery office and ask them questions. We do not provide any advice. We are not allowed to do that. We don't tell them what they should do. They need to contact the state recovery office and speak with a member in that office to obtain additional information regarding that. And unfortunately, we have had some folks from our referral list decline to apply because of the State Recovery Act.
Ms. Wiley asked, what if a person has a child that lives in the home?
From my understanding, I believe that if the adult child lives in the home, if they're disabled, Alabama Medicaid cannot kick the person out of the home. Alabama Medicaid cannot kick your spouse out of the home. But do understand that once that person, the living relatives that's in the home, once they pass on, that home is still, whatever's left over is still going to go to Alabama Medicaid. They can't legally kick them out of the home. I like to put it this way. It's like basically, I have my house. I need services. I apply for services. I die. My husband stays in the house. Well, he can stay in the house, but technically the house belongs to Alabama Medicaid because I used, Medicaid funds to provide my long-term care. So after he dies, if there is no surviving heir, yeah, Alabama Medicaid could get the assets to that house. Any questions before I go to the next part?
No, ma'am.
Okay. And let me know too. I can also give you all the phone number for the State Recovery Office if you all would like that. I can actually send that information to you, Sean, and you can get it to the folks if they need it.
That's great. Yeah, I'll do that. And they also asked for your slides, so I'll send those.
Yes, yes. All right, so intake referrals. Intake and referrals are received from RPCGB's website. So we have changed our intake process. We still take referrals over the phone. We have an administrative assistant that does that. However, to diminish the time she spends on the phone, we have implemented a new system in which the referral form is on our website. So professionals can certainly go onto the website at any given time and submit the referral. The referral will be sent to our administrative assistant. She will add the referral to our database, and then our screener will screen that person to see if they're still interested in being assessed for the Medicaid waiver program. Assessment coordinators are assigned to the referrals, and we conduct the in-home assessments for individuals who are interested in applying to the program. And I want to say this because this has come up before. Medicaid waiver is not an entitlement program, as eligibility is based upon nursing home level of care and financial eligibility. There has been some confusion in the past or in the community that it's an entitlement program. It's not an entitlement program. It's based upon eligibility, and everyone is not eligible to receive the long-term care services. And it's a case-by-case basis. Are there any questions on our referral and intake process?
There were no questions. There was one person asked if there is I think she meant if there is no family member, what next? Or maybe she said if there is a family member. But her question was, can you pay to recoup the home? Which I say, yes, you can. You just pay that amount that Medicaid says you owe, and you get to keep the house.
Yeah, I believe I have heard that as well. That the family who or whomever, they can pay that money back to Alabama Medicaid to keep the home. But again, I will give you, like I said, Sean, I'll give you that information for the state recovery office, because that's something that, for those that have questions regarding that estate recovery, I would like for them to speak with them, personally, to find out that specific information. But from what I understood, I think that is acceptable. I'm sure they're not going to turn away any money.
No, no, they're not.
Mm-hmm. Okay, I'm gonna go to the next slide. Um, this is our contact information, our main line, our fax number, our website. For individuals that live outside of Jefferson County, they would have to contact 1-800-AGE line. Our office serves Jefferson County. We do have other Medicaid waivers in, Shelby, Blount, other counties as well. But we service Jefferson County. Now, I know that was pretty much a short slide, but I'm open to discussion or questions. If anyone has any, I'm here.
I was thinking yesterday, I couldn't remember who in Shelby County administers this waiver program. Is
Oh,
it
in Shelby County?
M4A? It's not there.
Yes,
It
yes,
is.
M4A, yes.
Okay.
So we have AAAs, COGS, and RPC. And so, for example, we are Regional Planning Commission of Greater Birmingham. We are not a AAA. We are not a COG. We do not have all the aging programs. Jefferson County is a bit different. So where are the other aging programs? They are with United Way of Central Alabama. United Way of Central Alabama has the senior RX, the Alabama Cares. They have those programs. We
Okay.
just have Medicaid waiver. Now, we do get referrals from United Way, every month, but they have the other aging programs.
Hmm. So, of the 150 people you assessed last month, how many of them were approved for service? Do you know?
Oh, no, that wasn't assessed. That was just the referrals that we received.
Oh,
We received 150 referrals for 1 month.
and then of that number, how many will ultimately receive service, do you think?
If I had to guess, I would probably say maybe 40.
Okay, so about a third.
Yeah, because a lot of times, like I said before, a lot of folks make the referrals, but the members don't want the services. And
All right.
we have to respect what they want. Now, let me say this. I have also instructed my team, when we go out and talk to them about the program, and if they say, hey, Mrs. Johnson, I'm not interested, I still give them my business card. And I've instructed my team to do that as well, and still give them a brochure to let them know that, hey, you may not want it right now, but if something changes in the future, you can give us a call. We don't just leave them hanging per se. We
Right.
let them know if they change their mind, because sometimes they change their mind, maybe a couple of months down the road, or maybe a year later, their health status has changed and unfortunately declined, and so they may need help. We also have members that, we assessed them in the past, but they didn't get approved, or they self-terminated, or they moved out of the state, or they moved to another county, and they want to get back on our program. When it comes down to the Medicaid waiver from another county, they can be transferred. So a person can be transferred from M4A to Jefferson County. They don't have to start over. If they terminate that person at M4A, then they have to start over if they're in Jefferson County. But the case manager should know that they can transfer their clients within the state to another if they're moving from one county to another. Now, if a person is moving from Alabama to Georgia, they cannot be transferred. Medicaid is different in all 50 states. The income limit is different in all 50 states. So there's no way for that to even take place to transfer from one waiver in one state to another state. And some states offer more services or different services as opposed to the state of Alabama. So it just varies.
And how long does it take someone? I guess this is, well, never mind. I know the answer. I answered my own question in my head. Sorry.
It's okay.
Um, I have a couple of questions for you here.
Mhm.
One is, does as far as medical supplies, Ms. Albright is asking, does that include diapers?
Adult diapers, yes.
Okay. And Ms. Jeffrey says it sounds like a lot of the referrals decline services, but what about a percentage of the referrals that meet it financially?
What is she, what?
I think she's asking, of the 150 referrals, how many of those were financially disqualified or qualified?
I can't answer that because they're just on the referral list. So we haven't even been able to assess them yet. That's how many
Oh,
referrals that we are getting every month.
wow.
I'll say this, that maybe this will give everyone an idea. We are getting more referrals than we have manpower. I have 4 assessment coordinators and then myself. That's only what, 5 of us. If 300 referrals come in a month, there's no way that we're going to be able to get to those people in that same month. Also, we carry cases over from previous months because these cases are pending. They're
Right.
pending the state office. They're pending Alabama Medicaid. That's the part that most individuals do not understand, or well, not, excuse me, correction, not understand. They don't know about the inner workings of the application process itself. There are so many steps in this. And the state office now requests medical and progress notes on some cases. We have a lot of children who apply to our program, and sometimes, the parents may want a certain amount of hours. That's not approved by me nor my team. That's approved at the state level. And more than likely, it's on a case-by-case basis. And if a parent or parents or guardian, let's say if they're requesting 50 hours a week, they have to show a breakdown. They have to give a breakdown. So why do you need 50 hours a week? Give us a breakdown of exactly what is your day like helping this member that it equates to 50 hours a week. They now request breakdowns, medical notes. So during this initial assessment process, my team members and I, we do try to request medical notes for children. Those are basically that are under the age of 19, because we know that they may request medical notes. And that way, if the nurse should ask for them, we can go ahead and send them off. When it gets to Alabama Medicaid agency, they're going to request medical notes too. They want to determine if this person is eligible to receive long-term care services. If a child is SOBRA, they have full Medicaid, but it's not full Medicaid for long-term care. So for that applicant, the 204, 205 application has to be completed. And on the 204, 205 application, the parents, guardian, they have to answer the income question. We come across many parents and guardians that don't want to answer that question. You're asking the state for help. You have to answer the question. And the reason that they want to know, I found out from the Alabama Medicaid supervisor, they have to rule out that the child does not have accounts in his or her name. So we don't have anything to do with that. But if they leave it blank, Alabama Medicaid is still going to ask them for that information. I'm sorry. Excuse me, need a little water.
So that's interesting, because that was the question I started to ask and didn't,
Mhm.
was is it two separate processes? First Medicaid, and you must get Medicaid then to have waiver.
Well, you have to have Medicaid or be eligible for it.
Right.
So yeah, that's where the income limit comes from. And see, the thing of it is that there's also some confusion about Medicaid for health insurance purposes. So for example, I need health insurance, but let's just say I don't have health insurance, so I'm going to apply for Medicaid. Well, Medicaid in the state of Alabama, your income cannot exceed $963 a month. If it
What?
exceeds, yeah, yeah, yeah. I'm gonna give you that document too that shows that in writing, so you'll have that.
$963 a month.
No one can live off that. I don't care who you are. Yeah.
No, you can't live out in the street on that.
No, you can't. But that's the income limit for Medicaid in Alabama. And every January, that limit goes up. So for health care, cannot exceed 963 a month. For long-term care, which is Medicaid waiver, the
Uh-huh.
income limit is $2,829 a month. There's a difference. Do
Okay.
you follow?
I do.
Okay.
I don't
So, yeah.
understand why that is, but I think I got it.
Yeah, I don't know. I'm just going to assume maybe politics, which I'm not going to talk about. But I think that that's more political if anything. But also too, I've learned. I used to work at UAB at the 1917 HIV clinic, and I learned quite a few things regarding funding. I learned from Dr. Raper that, um, with the Ryan White grant, they used to get funds. But he also told me that the state of Alabama does not get as much as other states for HIV care at that time. So, like, for example, New York would get a hefty amount from the federal government slash, in terms of the matching the dollars, whereas California may get a lot, but Georgia may not. Florida may get a lot. Alabama may not. I don't know who determines that. That's more so way above my pay grade and probably on a federal level. But I learned that from working there that the money that the states receive, everyone does not receive the same amount. And Alabama is one of those states, whether we like it or not, they receive federal funding, but it's not going to be the same as New York or California.
Yeah, and
It's
we
just
didn't
not.
opt for Medicaid expansion under Obamacare because it was political,
Mm-hmm.
which just hurt seniors and
Yeah.
children in our state.
And it's also hurting, even I saw this on the news a couple of times about the hospitals by the Medicaid not being expanded. These folks that are coming to the hospital, they don't have coverage.
Especially rural.
Yeah, yeah.
Ms. Wiley is asking, is there a shortage of workers within your agency and are you a state agency?
Um, I believe we're considered a state agency since we're under Regional Planning Commission. And do we have a shortage, what, in our office
Yes,
or
I guess in your office.
no, we don't have a shortage.
You just have, well, you have more referrals than you can do.
Right. And also, I like to say this, people are living longer. I don't think that some of us really hone in on that. We're living longer. We have more medications to take now to help us live longer. The longer we live, the more resources we use. That's how that goes. So now
Yep.
let's look at it from a perspective of Medicaid waiver. Let's look at it from a perspective of resource. Well, more people are living longer, so that means more people are going to need long-term care. That demand is greater than the manpower that we have. Of course, my supervisor, we are working to get, assessment coordinators added to my team in the future, but there has to be funding. We have to have funding. And also too, with the case managers, to be honest, when the case manager, if they should resign or what have you, it kind of puts a hold on expanding our team because we have to make sure we have a case manager for those 40 people that have to be seen every month. And unfortunately, Alabama Medicaid does not budge on those monthly visits. Even during COVID, they still had to do the face-to-face visits. Now,
Hmm.
but they did have some exceptions. Okay, but for the most part, they want case managers to go into the home and lay eyes on the member every month. And it's
That's
funny
a
because,
pretty big task.
and you know what's so funny about that? I learned that the Medicaid waiver program in Georgia, they see their clients every 3 months. But Over here, it's every month. But their case managers have more clients assigned to them because they go out every 3 months. But
Right.
it
They
just
have more
depends
money,
on,
probably.
yeah, it just depends on, who's in charge and who's over that and, how they do that. I mean, I think monthly visits are important. I think that members that do not require a high level of care, maybe they can go every 2 months, but that's just me and my wishful thinking in my head. Excuse me. Sorry. But in our office, we don't have a shortage at the moment.
Okay.
We're constantly growing. Of course, the more people we get on our program, my supervisor knows that they have to start the interview process to get more case managers. Same thing with the assessment coordinators. So we're constantly growing. So that 950 is probably going to turn into 1,000 at some point. That 1,000 is going to turn into, it's just going to go up.
Well, I don't see any more questions. Miss Wiley says Mississippi sees clients monthly as well. I think
I've
she
heard that
works
they
in
do too.
Mississippi.
Yeah.
So we've met our 50-minute limit, and I will share now with you, share again the evaluation link and our password. Our password is easy to remember. It's Waiver, and that's spelled with a capital W. AIVER. Waiver is the password to the evaluation. I'll read the link one more time for those of you who might be watching this via YouTube. The link is https://surveymonkey.com/lowercase r/all uppercase letters, D as in David, H 9, N as in Nancy, 6 R V as in victory. That's our link. Waiver is our password. Thank you so much, Miss Johnson, for being
No
here.
problem.
Learned a lot. I really appreciate your time and effort. And if you'll share that information with me, I'll share it with the attendees. Remember, in order to get a certificate, you must do the evaluation. And I'll be sending those out either late tonight or tomorrow morning. Please join us again on Monday, December 2nd, when Dr. Jason Newell, who is with the University of Montevallo, will present a unit on supervision. So we've been asked many times to do supervision, and now we have, one of our state's more well-respected instructors of social work who will be sharing that with us next month on Monday, December 2nd. Thank you, Ms. Johnson, for being here today and for all of the effort that you put into this. I appreciate it. Thank everyone for joining us. If there's no more questions, I'll end the meeting for us today, and y'all have a great week.
You all have a great week, and thank you for having me. And Sean, I'll send you that information so that you can send it out as well.
Great. Thank you so much.
Thank you. You guys have a great day, and thank you for having me.
Yes, ma'am. Thank you. Bye-bye.